Great. So, ani Wikwemikong, Gimanin, Wikwemikong COVID-19 and all we debat among Monday is we have mapi Wikwemikong was another mag on gaining way mapi and Kitagian. Non go we the bin geok we know the debat on in Nakiat Megwa. Police Chief Terry McCaffrey madwe mapi manage not the wedge gig in Nagdoendung, Mary Jo Wabano. We know the Batana, in Nakiat. So good afternoon, everyone from Wikwemikong. We're here today to provide some updates and some information for the community in regards to what our preparations and what the actions have been to support and protect the people of Wikwemikong. So I thank you for tuning in. I know. First of all, I want to thank all of our staff for having the ability to put together the information for us that we're able to share with all of you, as well as our healthcare personnel for making the preparations for the impending surge in COVID-19 into this area, and we hope we don't get to that point. And in saying that, I do want to confirm again that there are no cases of COVID-19 here in Wikwemikong. There have been 2 cases reported on Manitoulin, but I guess what's the latest information that we have from Public Health, the Sudbury District, is that there's been, I believe, 4 more cases that have been identified as of today, and what's a cause for concern, and which is why we've been stressing the point about limiting our travel, and if we have to travel, that we make sure that it's a limited amount of people, and to be very mindful of where you're going and what you're touching, and take all necessary precautions, because the evidence of the COVID-19 virus coming from the public health officials is that it's spreading within the community of Sudbury. And when they're talking about community spread, they do not have a single source to point towards on where it's originating from. So abedek kina ishbin we zagjeng we jat abedek we on the gomes gego dog the man gego my wayna abedek we masse Chibesha Witsema Siwia. So if you do have to go outside to the larger centers like Sudbury, that I'm asking you to take all precautions to keep yourself separated and distanced from people in if it's a grocery store that you have to attend to, then keep your distance from people and take all precautions. Wash your hands and do not touch every single item that you think you might need. I think this is the time when you have to do the planning that we've been recommending, that if you require essential supplies, that you only purchase those essential supplies and grab what you need, as opposed to shopping around to a whole number of places. So the evidence is out there that this COVID-19 is in the Sudbury region as well as on Manitoulin, and what's concerning to the health officials is that they're pinpointing that it is being spread within the community. So we do have to take precautions, and I do want to stress that. And they're provided some details today in their update, and they've identified some of one individual as part of community spread is under 19. So the young people that are out hanging around with your friends, this is the warning for you that we're not immune to it. And I could say that because there's been a number of young people and young adults and adults alike that are not taking this seriously. So we want to make sure that you take this seriously, and that to keep your physical distancing as one of your main priorities. So I do wanted to say that as part of the opening for this live stream session and an update to yourselves. So we are continuing to work hard to monitor, prevent and protect the community. And as you can see, over the last 48 hours now, that we've initiated a wellness checkpoint in Buzwa for people coming into the community, and we're advising people that are leaving the community to take precautions and only travel if necessary. So there's an opportunity for people to turn around if they feel overwhelmed, and there's nothing wrong in that. I suggest that you reach out to some of the programs, the essential programs that are here still working, and reach out to what you may need assistance with. So if it's, for instance, you need some groceries or prescriptions, we need those suggestions for you to provide to us so that we can take those issues into account and develop the programs and identify staff that could help with that. And you will see on the live stream there's an email on there, suggestions@wikwemikong.ca, and it will be monitored, and it's an opportunity for you to provide your suggestions on how to assist every single one of us that is working here, assist the leadership, because we all have that responsibility to help out. This is something new for everyone. It's not like this is everyone or our staff or anyone across the globe have any experience in this. It's a lot of this is new for many people right now. So we're offering up that email address in addition to whoever you feel comfortable with. You can call them also, but please offer suggestions. We're here to help. We're trying to assist where we can and with what we can. So I want to make sure that we're all able to do that. And in continuing the message, we're urging people to stay home as much as possible and not to travel. We want to ensure that you know what the precautions are by hand hygiene, physical distancing. If you're coughing or sneezing, make sure you do that into a tissue or onto your sleeve. And even in saying that, if somebody is coughing next to you, it does not automatically mean that they have COVID-19. We have to remember that it's still flu season. People do have colds, as well as allergies are going to be flaring up right away. So just be mindful, everyone that has those ailments at this particular time, that those do not necessarily mean that an individual has COVID-19. So we want to stress that our objective in all of this is to keep the well-being of our community intact. We have much things to rely upon. We have some of our teachings, we have our medicines, and those are some of the things that we do need to rely upon at this time. These are things that are going to help us with our well-being. These are things that are going to help us build up our immune system, along with the rest of the health recommendations about physical distancing and hygiene. Those are things that are going to help us with limiting the spread of this COVID-19, because that is the overall goal. And in fact, the easiest way for all of us to do that is for us to stay put and stay home, because this thing cannot spread if people stay home. The people are the ones that are carrying this virus, and if we all do our part, it will not affect our community. So in saying that, I'll have a few more comments after, but I'd like to turn the camera over and introduce our Health Director, Mary Jo Wabano, to offer some comments on behalf of the efforts of Wikwemikong. So, miigwech. Mary Jo.
Good afternoon, community members. I'm just going to give some overall health messaging that definitely we need community members to be aware of. The health center staff continue to work, whether it's from their home or some of them are still on site at the health center. And the ones on site are pretty much the staff who are providing those essential services, staff to members who absolutely need to be seen face to face. So those are essential appointments that are made. We have no more, at this point, any walk-ins to the health center. Everything is done in advance through appointment only, which is also supported through our medical team, so our family health doctor and or our staff from Nojmauntech, the nurse practitioner or physician. You'll still be screened the day before your appointment, and the day of you're screened again by the respective staff at the health center. During that time, during this time, we will limit those face-to-face appointments. You'll likely get a phone call from your physician to do an actual appointment by phone, so you'll be prepared for those calls, and you probably are already receiving them. There's been a question out there about Nokomisnung. Nokomisnung shelter is still operational, so if you have that need, you are wanting to get out of that volatile situation at home, your environment, then you need to call Nokomisnung and go through the screening process there for intake. So they are still taking clients. So that's the update there. Our well-being health checks. Some of you have already been receiving those phone calls, and there is a procedure that's been established, and we have many people working towards meeting that demand. And it's for our purpose as a community to call each and every one of you, which means we need your full cooperation. We need for you to, to accept that phone call, to answer the questions, and to be prepared to get that call every day. So various staff are assigned a list of individuals, and we're already learning that phone numbers are out of service, out of date. So if you have a new number, please send it to us at the health center. You can call the health center, you can leave it with our reception, and they'll send it off to the respective department. So we're asking for your full cooperation, and the point of that is to begin our own monitoring as a community, because as Gima mentioned, we don't know. It's so we don't know when it's going to happen. So we want to make sure that each and every one of you are aware of your own symptoms, and you have new family members who have returned home. The same with them. We want to be aware of their symptoms. If at any point we see the need to continue monitoring, and we'll continue monitoring you. You're going to be on a list of assigned to a specific individual that's doing the screening. And at any point there's a need for that referral, you'll then be followed up by one of our nurses. So that's our commitment. Again, but we need the cooperation. So we're committing from a health perspective, but we need the commitment from the community. So that's looking at a daily call, and this does not stop Friday at 4 o'clock. We're going to continue making those phone calls Saturday and Sunday. We have established another schedule to have that service offered throughout the weekend. So this doesn't stop at 4 o'clock. The community care packages, I know there's been some delivery of those, and we have seen a high demand for that. Again, we ask that you be patient with us. We were working off an established list from the Christmas hampers, and that list itself has evolved into a larger list. So our staff are working the best that they can right now to meet those demands, but also we ask that if you have not received a package, a care package, again, we ask that you send that information to our staff. And if you have, I think what we need to do though is put up those phone numbers at some point so community members are aware of which number respectively to call so you're not missed. And we're trying to do what we can so that every household that has that need, again, it's limiting the need for you as a community member to leave to go shopping, you know, and should you have to go shopping, you need to identify a member within your household to be that designate. So you're not sending 5 different people from your home to go do the shopping. It would be one person specifically, which could be the same person that picks up your prescriptions. So those are some key things to be mindful of as a member of your household, identifying who that key person might be. We do have a priority list within the care packages. Again, that's being facilitated by the working group itself. And we, as part of that care package, there is a questionnaire that accompanies the care package. So we are asking members of the household to identify if they are in need of that care package. If we want to talk about the self-isolation and how that might work in our household, we want to again, somebody coming home, and it might be that member who has returned from college or university, keep in mind that they are coming from another environment. They are welcome into your home, but you need to be aware of the potential that there is, that individual could be, may have been exposed to COVID-19 from wherever they're coming from. And that's any one of us who have traveled you know, beyond the borders. So those are just some of the main areas that we need to focus on. We may also feel overwhelmed, and we might need that reassurance that, gee, I wonder if I'm these symptoms I'm feeling, if I'm going in that direction, and if I'm going to be one of those members affected with COVID-19. For your reassurance, I would advise that you call the Mental Health Center and ask that COVID nurse those specific questions. And maybe you're going to get an answering machine, and you're still, you know, feeling overwhelmed with that unanswered question. Call our nurses at Wikwemikong. So you could either call the Mental Health Center, 368-2300, and go through the prompts. You'll likely get an answering machine. If not, that's great. If so, and you want to reach out to our nurses, you call 859-3164 and ask reception to put you through to one of our community health nurses, and they can answer those questions. So again, it's to provide that ease of mind for you, and you don't become over stressed about, you know, those signs and symptoms. So I think we have that opportunity to help you. Our nurses are going to help monitor those signs and symptoms. So please take that advantage of those phone calls. The other is mental health anxiety of not being able to visit your family members. You might be feeling, gee, I really want to visit my grandmother. I really want to visit my mom. And knowing that social isolation is a key factor to address this issue we're faced with today. We can also support you by calling our mental wellness crisis response team, and that number is 705-348-1937. We have people 24/7 that's there to take those calls. If you want to talk to somebody, reach out and make that phone call. We also ask that if you have a family member who's located in a dead zone, just thinking of, we don't have that phone cell service, we don't have internet connectivity, they don't have a landline, please let us know if that family member is within your circle, and we can connect them. We can possibly assign a cell phone, but we would like to know who they are. So reach out to us, let us know who those family members are. That's it for now, and I'll wait for questions.
Okay.
Miigwech.
So Miigwech, Mary Jo, and we'll ask our police chief, Terry McCaffrey, to provide an update from the perspective of policing in the community. So, Terry?
Thank you very much, Gima. Good afternoon, citizens of Wikwemikong. The situation involving COVID-19 is continually fluid and continues to change on a daily basis. I want to start off by reassuring you all that WTPS is well positioned to respond to this current situation. The WTPS takes the health and safety of our community, our officers, and our staff very seriously. It is important at this time that our community takes this serious. It is also important that we are prepared and informed. But it was most important that we do not panic. Your community leadership, your public health department, and your police service work in concert with all of our social services to ensure that our community is well taken care of. That being said, I want to provide a couple of very short updates on some modifications we've made in our policing services. So because we come into contact with the public on a regular basis, sometimes attending our facilities and sometimes being in our vehicles, we have put in place extreme cleaning measures to ensure that we're mitigating the spread of any COVID-19 that may have come into contact with our police cruisers, with our officers, and with our detachments. We have also provided our officers and staff with a number of personal protective equipment measures to assist with keeping them safe and their families. So that being said, there may be occasions where officers are attending a call for service and you may encounter them. Just understand and respect that they will be looking to ensure that they are respecting social distancing, keeping proper distance from people when attending different calls for service. And they may also be showing up wearing different protective equipment, masks, gloves. It's not to offend anybody, it's just to take precautions to ensure that we're not infecting any of our emergency personnel. As of yesterday afternoon, our front counters are now closed. However, that does not mean that anything changes with our attendance for calls for service. Currently, our response times have not been affected. So our officers are continuing to respond to calls for service in a timely and efficient manner to keep our community safe. We also continue to dispatch our officers to calls based on a priority. So when you contact the communication center and provide them with all the information that you have, they will place that call in the different various priorities. So that being said, when you do call the communication center, they may have some new questions for you. So I'll just share with you very briefly some of the questions you may now encounter. You may hear, have you or anyone in your household come in contact with someone who tested positive for the coronavirus in the last 30 days? They will also ask, have you had a fever or cough in the last 3 days? And if you have traveled out of the country within the last 30 days. The reason for this is for the protection of the officers and staff that may be attending to the different calls for service. All of the information that's gathered is kept very confidential, but it is always to ensure that we're keeping our officers and staff and emergency personnel safe when they're attending calls for service in the community. So I do ask for your patience during this time while these questions and while some of these modifications to some of our service delivery models are taking place. I would like to make a quick note about parties in the community, social gatherings. Our officers do have the authority to modify social gatherings and break up parties. At this point, we have attended some calls for service like this. Everybody needs to understand at this point in time that this is being taken very seriously. There are emergency orders in place for officers to break up large groups, and this includes parties in the community. So that being said, now is not a time for that. Now is a time for social distancing, and ensuring that we're respecting that for the health and well-being of all members of our community. As well, a note about the checkpoint. So currently, there is a well-being checkpoint in the community that WTPS is assisting with supporting to ensure that that is a safe place. There has been a couple of incidents where people might have not been respectful at the checkpoint. It is important that these people that are providing safety at the checkpoint are respected. They are looking out for the best interest of all of us, every one of our community members. So please give them the time, give them the respect, and please answer the questions as best you can. This is not, nobody is looking to interfere in anybody's personal information. This is all about making sure that our community is safe, secure, and healthy. On that note, I would like to close off by saying, on behalf of myself, the WTPS, the Wikwemikong Tribal Police Service Board, I want to thank the citizens of Wikwemikong for your commitment to social distancing. I want to share with you all, as your Chief of Police, as a husband, as a father, as a grandfather, and also as a community member, that I recognize that we're all facing this together. We're all in this together. I am proud at this point to stand with us at this time of need. It's very important that we are all working together towards flattening the curve and ensuring that our people remain healthy and remain safe. WTPS will hold steady with you. And the truth of the matter is that just like all storms, this one will pass too. Miigwech.
Miigwech, Police Chief McCaffrey. So just want to not necessarily end off, but offer a couple additional comments, and one of them being that as a Wikwemikong Anishinaabe, I've always grown up in an environment where all of our community members took care of one another, and I want to stress that it's important for us to love our neighbors, love our relatives, and love our acquaintances, love our friends. Like this is the time for that. That we all come together and hold each other accountable for some of the warnings and the issues that are being raised by our health director and our police chief. That we all need to do our part because we're trying to limit the spread of this COVID-19 illness, sickness, and we don't want it to have a bad impact in our community. So I'm asking for our people to be mindful that in the unfortunate instance that someone might get this virus, that we are making preparations. Those preparations are in place, not only here within our community, but throughout the Manitoulin district, where just yesterday there was an announcement by the Manitoulin Health Center where they're establishing a secondary hospital site at the Northeast Manitoulin Island Recreation Center to support the Manitoulin Health Center in the overflow of cases should that occur. But keep in mind that we're doing our part to prevent the spread of this virus. But we are taking precautions and we're preparing for the worst. But by doing our part, we're going to have to really get serious about this. We all have that objective, and we want to make sure that does not spread to our families. And because of what we're saying, like, it does have an impact on our thoughts and what we're feeling. I know I've seen some episodes of fear, anxiety, and just because this is new to everyone, we're trying our best. All of our staff we're relying on the experts that we have to provide the guidance, and we will be making adjustments as necessary. And I think the point about this evolving almost on a daily basis, calls for that adjustments as necessary. So we require your support to continue respecting the people that are doing the work on your behalf, and to provide those assurances to those that are on essentially the front lines doing this kind of work for us. So, and I would suggest also that in being grateful for the people that are working on our behalf and protecting the community, that we also take this opportunity to spend time with your loved ones. There's nothing saying that you can't go out for walks with your family. Just be mindful that if you've been practicing social distancing already, I think it'll come naturally to yourself. And I'd recommend one of our coping mechanisms as Nishnawbek is to continue to laugh and enjoy the company. We're fortunate that there is technology available to us that where we can interact with each other. I'm seeing really good examples of that by families using some of their own cell phones or their computers, where they're having family conversations on some of the social media platforms that are there, either whether it's FaceTime or Facebook group chat or Zoom chats. Those are available, and we'll make sure that we put those, perhaps some instructions onto our website, so that you can begin using some of those things to check in on people. It's another tool that could be used to ease your anxiety in this situation when we're being asked to limit our interaction and our regular coffee chats with our friends. Another thing is that I would suggest is to limit your exposure to some of the news. Keep it to a minimum. If you can handle hearing what's being reported in the news outlets, then I'll leave that to you, but my suggestion is keep it to a minimum, just for your own well-being. And if you're going to be looking at information, there are a number of websites. We have our own Wikwemikong.ca website, our health center, their website. There's plenty of information available on public health in Sudbury District's website. If you're looking for credible sites to find information on this COVID-19. So I'd like to proceed into some of the questions that were offered up for as part of this discussion, and we'll try and get through most of them, if not all of them. But one of the first ones is that are non-residents still being permitted to come into Wikwemikong to purchase cigarettes, shop, and do laundry at the laundromat? So the current situation is that with the checkpoint at the community, we haven't limited visitors by non-residents as of yet, but we're still monitoring the situation on a daily basis on who's coming in and for what purpose. So we're going to be analyzing those details, and in saying that, the traffic over the last 24 hours has gone down, and in asking the questions about the reasons for coming here is primarily most of the traffic is telling our workers at the checkpoint is that they live here. There's plenty of them that are delivering. What's concerning though is that there's some that are saying that they're coming to visit, which is not recommended at this point in time. And there's many individuals that are not offering up any information on why they're coming. So we're going to have to explore that issue itself. So in saying all that about non-residents coming here, it is still being analyzed on what the best approach is going to be, and how do we continue to support our local businesses also, and how do we maintain our current food supplies as well as medical supplies to our community. So we have to it is a situation that is evolving, and that decision will be made by committee in collaboration between our emergency control group and our council, if that time comes. So secondary question, or second question here is, why isn't the border being completely shut down with the exception of deliveries and essential workers, considering what has happened in other parts of the country? And why are we waiting for confirmed cases before taking this action? The council has had this discussion for the last number of weeks, as well as our staff with the emergency control group. We've established a subcommittee who are what we're calling the well-being control group, and they're the ones that are assisting in establishing the checkpoint, determining which questions, and they're tasked with providing that guidance to the council and the emergency control group. So in establishing the checkpoint, it's a precautionary measure. We viewed it as we need to establish an education process for our community members that there are alternatives to travel, that services are in the community where we've initiated delivery of food items to those that need it. We're trying to spread out that supply to as many people as possible in order for us to limit your travel to outside of the community. So that message we hope is getting out there but in answering the question about the complete shutdown, we may get to a point where it is a complete shutdown, but we have to ensure that services are still available for our community to function. We have to take into consideration a whole number of impacts, and we want to make sure that the well-being of the community is intact. Is a complete shutdown necessary? Perhaps not right now, but perhaps it could be in the very near future, which is why we're continually monitoring and getting as much information as possible so that we can make that informed decision and provide the necessary notification to yourselves as our citizens. But the message still remains the same, is that the safest place for everyone is for everyone to stay put where they're at. If you do not need to travel, then there is no issue, there is no need to close borders. So it's a lot easier for us to make those decisions or monitor the well-being of the community if we all do our part. Does he have anything else to add to that, Police Chief?
No, just that there has been a lot of consultation about the well-being checkpoint, and there's been some discussion around whether or not the border would be closed or how that would work out. What I can say to this is that WTPS has created alternate delivery for our services, and we're well positioned to be able to take over should there be some type of a controlled access point there. But either way, we'll be supporting our community and our community's decisions, and working together to ensure that our community stays safe and stay healthy. So if that means at some point in time that there is some decision made in the matter of public health to ensure that our community stays controlled, we will be there, and we are prepared to assist.
Yeah. Thank you. So the another question that came in as part of this live stream is self-isolation required for all those who did maple syrup making with family others who don't all live together? Seeing that a lot of people still took part in this tradition regardless of safety message. So Mary Jo, perhaps you can help me answer that.
So any activity of 5 or more, we know now is discouraged. So maple sugar making has already happened and may be continuing to happen So we know that 20% or more of people in a gathering could be a carrier. So when we think of larger groups coming together, you could possibly be now sharing that with and infecting other people. So the simple answer to that is just stay home, continue with the social distancing. And when we're calling you and asking you those questions about through the screening process, we ask that you be honest. You let us know, yes, I was a part of my family gathering and this is where we were. And that's one way of us to continue monitoring should you develop those symptoms that we are watching out for. And again, we want to keep track of you for the next 14 days and monitor those symptoms. So it goes back to practicing what we've been messaging for the last few weeks. And we really need for you to be honest with us and help us, work with us. And you know, we're helping you and we're helping the community to protect one another from this virus possibly spreading in our community.
Miigwech, Mayor Joe. Another question here is how do parents go about access visits for their children who reside out of Wikwemikong? So the recommendation currently is for families or caregivers or custodial parents, primary caregivers, for the children to remain with them for the next foreseeable future. If there are access visits that you're going to have to consult with, if it's Wikwemikong, you're going to have to consult with them on if that's going to be available, but currently they're not recommending any access visits for the safety of the children as well as those that are going to be coming in contact with each other as a result of that travel between the two places. So, but it doesn't hurt to reach out to Wikwemikong or the childcare worker that's responsible for the placement of the children into those homes, as well as reaching out to our band rep services for some guidance. So another question is, how is Wikwemikong enforcing social distancing and self-isolation? So what we're doing is we're still encouraging the community to practice physical distancing and to self-isolate if you yourself know that you've traveled to certain locations where you may have become exposed. The current guidance right now is that from the public health officials is that if you've traveled outside of Canada is one of the main ones, or you're exhibiting symptoms. But those aren't necessarily the markers of what we know, and what's being shared by the health officials is that the incubation period of this COVID-19 runs anywhere from 2 to 7 or 8 days prior to seeing any symptoms. So in saying that, if you are traveling, it is recommended that you do self-isolate to not only keep yourself safe, but also those that you love. This is on an honor system at present, but we have seen the federal government bring in measures that require those that are coming in from outside of Canada to isolate and quarantine themselves for 14 days, and they've given the provincial governments have given some additional powers to the police to enforce that. So I think at this point, I know at this point the decision hasn't been made for a mandatory self-isolation, but I do know of incidents of those that have traveled that have volunteered to self-isolate, and I applaud them for doing that. They continue to be supported for that. I myself have checked in on a few individuals to see how they're holding up, if if they're exhibiting any symptoms, and thankfully they haven't had any symptoms. So we continue to provide that support, but it is up to each individual to make that call to isolate themselves if they think they may have been exposed somewhere.
If I may jump in there?
Yes. Yep.
Gima, I would just like to add to that point that the federal and provincial government have provided measures for police in these very emerging times. So that being said, police do have the powers available to them to be able to enforce some of these different measures, self-isolation that has been mandatory, as well as social gatherings that are very large. Now that being said, it is not going to be our focus to look to enforcement measures right away. We are looking for cooperation from the community to ensure that we are working together to make sure that we continue to be healthy and safe. So that being said, we're not going to be out there looking to enforce these measures. However, we will be watching to ensure that people are cooperating and to make sure that our community stays safe.
Okay. So the another question here revolves around strict measures, but I think we've already answered that. The next one here is why do they take our license plates down when we leave and enter the community? So if an individual starts exhibiting symptoms and the health professionals, the doctors, recommend testing for COVID-19, they begin to start asking that person who has been tested, and ultimately if they've been confirmed positive, who they've been in contact with. So the rationale by our team at the border checkpoint in asking this question is to support the health professionals in determining who may have come into contact with a positive resulted individual. So that's essentially what it's for, is to help with that contact tracing. In case an individual, because of shock or stress or just it slips their mind on a time where they may have when traveling with someone outside the community, even if it's just the Manitowoc. I think that's it's a tool that could be relied upon by the health professionals to get in contact with other individuals who may have been exposed to someone who's tested positive. So it's a precautionary measure that will aid the health professionals. Mary, do you have anything else to add to that?
That's good.
Okay.
Yep.
Okay. So another question, what has to happen to have a complete lockdown in the community? Very tough question. I think I'm holding out hope that we all cooperate, we all do our part, because we all have a responsibility to keep ourselves safe, keep our loved ones safe, keep our families safe, as well as keep our community safe. So the same message applies. If you need to go anywhere, take precautions. But the safest place the safest and easiest opportunity for us to stop the spread is if we do not travel. In the event that there is a need for a lockdown, our emergency control group and the council do come together frequently to discuss this very issue. And at this point, there is not a need for it, but it is being assessed on a daily basis on when is that point. If we are going to be doing a lockdown, then we are going to be working in collaboration with the tribal police, the health officials, our health center, and all those that are working on your behalf to make that decision. Like I said though, if we all do our part, there would not be a need for a complete total lockdown. So I do want to stress that it's up to us to do our part. Kina we abde we not mage mando we jouer ba we non wedge gang anyway. So in I think there was a couple more questions. Two more questions came in. One was, we're coming into the spring season, and people are going to be outside. We're encouraging you to get fresh air because that helps with our immune systems. But one of the questions that came in is, what about mosquitoes or zgimek? So, Mary Jo?
Very simple, and these are direct words from one of our nurses. It does not live in blood, so it lives in your breath. The only human breath holds COVID-19. So that's the answer. So you don't need to worry about those mosquitoes or any other insects. Can I just add a few more? So I think I know the strong message to our members, to each and every one of us, that we need to work together to prevent any spread of COVID-19 in our community, in our household. So we all have that responsibility. We all need to be accountable to one another. And it's to protect not only yourself, but your family. I want to be able to see my family members. I want to be able to go and visit anytime, but that's not happening anytime today or tomorrow, anytime soon. We need to be able to work towards that because we all miss our loved ones, right? And you know, if I want to connect with my loved one that's in another community, I'm going to FaceTime, and I've been doing that. So I think those of us who have that ability to do that, keep it up. Those of us who are really hoping to do that, reach out to us and let's see how we can support you to maintain that connection.
So, do you have any closing comments, sir, please, Chief?
I think it's very important to recognize that the leadership in public health in the work that they've been doing to keep our community safe. All the social services in our community are working very hard. All of the frontline people that are working at Andy's at the grocery store, people that are working at the gas stations to ensure that we have gas for different items. All of these people are putting themselves at risk to ensure that we have all the services that we need as a community. So I want to applaud everybody and really thank everybody that's out there continuing to work. So please support them by staying home, support them by social distancing, and by ensuring that we are prepared, informed, but not to panic. This is not a time to panic. This is a time for us to stay informed, and this is a time for us to come together as a community. And I see us doing that, and I just really wish to applaud the work that is being done to keep us safe.
So once again, I want to say miigwech to everyone for tuning in. I think it's a great opportunity for you to get the information from the people that are working on your behalf, and this is the source that you should be relying upon for getting your information. So I want to just offer a couple parting comments for myself for this session here. Is that it is, again, it's everyone has that responsibility to support each other, including supporting the leadership, supporting the staff, supporting our local businesses. I think this is an important time because this is they're stepping up themselves to take the additional precautions to provide a safe environment for you to access those goods and services right now. It is additional cost on their part, but they've invested their resources into that to ensure that you have that ability to get those services here in Wikwemikong. So I want to make sure that when you see the people that are working out there, don't be shy to say miigwech to them, because we all have a love for the community, and we each have our role. So we want to, as a council, I think one of the messages that they did want to share is that for everyone to be honest about the travel, to really consider and reconsider your need to travel to outside of the community at this point in time. And in fact, some of our council members have advised their own children not to come home for when they're looking at on the calendar. I'm not even sure what day it is now. It's been going 7 days a week, but one of the holidays that are coming up that are normally on the calendar is Easter or Bokawan. Our own council members have advised their children to stay in place, stay where they're at in their apartments while they're away at school, because travel is very risky right now. And should they come home for that weekend, it's probably advisable, and depending on activities over the next 8 to 9 days, it may even be mandatory for individuals to isolate themselves for 14 days. So these decisions have to be made by families amongst themselves, but I can say that the council members have been practicing it and modeling it, and as hard of a decision it was for them to be separated from their loved ones themselves, they know it's safest for everyone, and they don't want to have that additional risk. So as far as parting messages, I want to thank you for your continued support, and I want to thank you for your support in respecting the individuals that are working on your behalf, and please cooperate with them. If they're asking you information, it's for the benefit of the community and the individuals that are working on your behalf to make these very tough decisions. These decisions are not taken lightly. This is a very serious matter, and we do not want to see this particular illness spread into our community. And if it does come in, we want to make sure that we're prepared, and we want to make sure that we can minimize its spread and effect onto all of our loved ones. So I want to say miigwech to everyone, and we will talk to you again soon. Miigwech ki bazin dajagake. Wikwemikong COVID-19.